My name is Ariana Hart. I currently attend SOAS University. Are there any implications of the vaccine that would have been missed that could come to light in the future that could actually outweigh the risk of getting coronavirus for young people themselves?
As a technology, it has been studied in clinical trials actually for over 10 years in different types of disease. But the vaccine itself has been approved for use by people over the age of 16. And in order to have been approved, the observed benefits had to outweigh the observed risks. So I think that young people can be assured that the benefit to risk ratio is in the right direction.
My name's AJ. I am 42 years old and I have a disability called spinal muscular atrophy, which is basically a muscle wasting condition which I was born with. What demographic of people were the trials carried out on?
People over the age of 16 were allowed to take part in the phase 3 clinical trials, and people in many different countries have participated. So places like South Africa, Brazil, India, a variety of different countries, North America. And that did include people who had other conditions that would make them vulnerable to infection and disease with COVID.
My name's Emily. I live in Manchester. I'm particularly interested in asking a question about the new vaccine because I have a condition called ME/CFS. I'm interested in learning about how new vaccines work and are rolled out in vulnerable populations that have chronic health conditions that may be confirmed to have an immune system issue involved in them, how the rollout will work for those communities and if it's been sort of tested on them yet.
The quick answer is yes, they were able to take part in those trials, but the information from those large phase 3 studies has not been made public yet. It has been looked at by the regulator, and we know that they licensed the use of the vaccine in the UK. And I know that the Joint Committee on Vaccination and Immunisation, who've also seen that information, have recommended that people with these conditions should be offered the vaccine.
I'm Barbara Jackson. I'm 77. For people like me who are allergic to penicillin and the trimethoprim group of drugs and also anti-tetanus, are there any contraindications to taking the vaccine?
You'll be glad to know that vaccines generally do not contain penicillins or trimethoprim. And we have over 40,000 people who took part in the vaccine studies of the various different vaccines. There were no serious allergic reactions reported.